and this swelling is often associated with warmth, a sensation of heat radiating from the joint area. The skin over the joint may appear red or feel hot, which is a sign of the body's inflammatory response. Reduced range of motion is a symptom that often accompanies arthritis, as stiffness and pain make it difficult to move the joint through its full range. For example, a person with knee arthritis may find it hard to fully bend or straighten the knee, and someone with arthritis in the fingers might have trouble grasping objects. This limitation in movement can affect a person's ability to perform everyday tasks, such as walking, typing, or cooking, further contributing to the challenges of living with arthritis. Finally, warmth around the joint is a symptom that often indicates inflammation. This is particularly common in autoimmune forms of arthritis, like rheumatoid arthritis. The heat may be accompanied by redness, and the joint may feel tender when touched. This warmth is a clear sign that the body's immune system is actively responding to what it perceives as an attack on the joint tissue, which is characteristic of inflammatory arthritis. Now that we've explored the most common symptoms, let's turn our attention to the diagnostic process. Diagnosing arthritis typically involves a combination of methods, as the symptoms can sometimes be similar across different types of arthritis. Doctors begin with a physical examination, which is often the first step in the diagnostic process. During the exam, the doctor will assess the affected joints for signs of inflammation, such as swelling, warmth, or redness. They will also check the range of motion and look for any deformities or structural changes in the joint that may suggest arthritis. The physical exam provides valuable information about the severity and location of the arthritis, helping the doctor determine the next steps in the diagnosis. After the physical exam, the doctor may order imaging tests to get a clearer picture of what's happening inside the joint. The most common imaging tests used in arthritis diagnosis are X-rays and MRI scans. X-rays are helpful in detecting the changes in bone structure that are common in osteoarthritis, such as joint space narrowing, bone spurs, or changes in the shape of the joint. An X-ray can also reveal the degree of joint damage, helping doctors determine the severity of the condition. For more detailed imaging, especially in cases where soft tissue damage is suspected, an MRI magnetic resonance imaging scheme may be used. MRIs provide high-resolution images of both the bones and soft tissues, allowing doctors to see damage to cartilage, ligaments, and tendons that might not show up on an X-ray. In addition to imaging tests, doctors often rely on laboratory tests to help confirm a diagnosis. Blood tests can be used to measure inflammation markers in the body, which are elevated in certain types of arthritis, such as rheumatoid arthritis. One of the most common tests is the C-reactive protein CARP test, which measures the levels of CARP in the blood. CARP is a substance produced by the liver in response to inflammation, and elevated levels often indicate an active inflammatory process in the body. Another blood test, called the erythrocyte sedimentation rate ESR or EST rate, can also help assess inflammation. These tests are not specific to arthritis, but they can help doctors differentiate between types of arthritis and rule out other conditions that may mimic arthritis symptoms, like infections or certain types of cancer. In cases where rheumatoid arthritis is suspected, doctors may also test for rheumatoid factor RF or anti-citrullinated protein antibody ACPA. These antibodies are present in many people with rheumatoid arthritis and can help confirm the diagnosis. However, it's important to note that not everyone with rheumatoid arthritis will test positive for these antibodies, and some people without RA may have them as well. Therefore, a combination of clinical symptoms, blood tests, and imaging is often used to make a final diagnosis. Sometimes a joint aspiration or synovial fluid analysis may also be performed. In this procedure, a doctor uses a needle to remove fluid from the affected joint to check for signs of infection or crystals, which are often present in gout and pseudogout. The analysis of this fluid can help confirm or rule out certain types of arthritis. Ultimately, diagnosing arthritis is a multifaceted process that requires careful evaluation of a patient's symptoms, medical history, physical exam findings, imaging results, and lab tests. Each type of arthritis has its own set of diagnostic criteria, and sometimes it takes time and multiple tests to pinpoint the exact cause of joint pain. The goal is always to arrive at the most accurate diagnosis so that an effective treatment plan can be developed, helping patients manage their symptoms and improve their quality of life. In conclusion, arthritis symptoms can be quite broad, including pain, stiffness, swelling, reduced range of motion, and warmth around the joints. Diagnosing arthritis involves a thorough physical exam, imaging tests like X-rays and MRIs, and lab tests that measure inflammation markers. With the right diagnosis, individuals can receive the treatment and support they need to manage their condition and continue leading active, fulfilling lives. When it comes to treating arthritis, the good news is that there are several options available to help manage symptoms, slow disease progression, and improve the overall quality of life. The right treatment for any individual depends on the type of arthritis, the severity of symptoms, and how the disease is affecting their daily life. Let's take a look at some of the most common treatments for arthritis today. One of the first lines of defense against arthritis pain is medication. For many people, pain relievers are essential in managing the daily discomfort that comes with arthritis. The most common over-the-counter pain relievers are non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, Advil, Motrin, or naproxen, Aleve. These drugs work by reducing both pain and inflammation, providing relief for people with conditions like osteoarthritis or rheumatoid arthritis. NSAIDs are effective for many people, but they must be used cautiously, as long-term use can lead to side effects such as stomach ulcers or kidney problems. For more severe pain, doctors may prescribe stronger medications, such as prescription-strength NSAIDs or acetaminophen Tylenol, which can help reduce pain but don't have the same anti-inflammatory effects. For inflammatory types of arthritis, like rheumatoid arthritis, the goal is not just to control pain but also to slow down the disease's progression. For these conditions, disease-modifying antirheumatic drugs, DMARDs, are commonly prescribed. These medications work by targeting the underlying inflammation, which can help prevent further joint damage. Methotrexate is the most commonly used DMARD, and it helps suppress the immune system to reduce the inflammation that leads to joint destruction. Other DMARDs include sulfasalazine and hydroxychloroquine, each with its specific uses depending on the type of arthritis. While DMARDs can take several weeks or even months to show results, they are key in preventing long-term joint damage in conditions like rheumatoid arthritis. In addition to DMARDs, biologic therapies have become a powerful treatment option for autoimmune forms of arthritis, especially rheumatoid arthritis. These are advanced medications that target specific components of the immune system, which cause the inflammation and joint damage seen in autoimmune diseases. Biologics such as etanercept, Enbrel, or adalimumab, Humira, work by inhibiting specific proteins that play a key role in the inflammatory process. These treatments are often used when traditional DMARDs are not effective or when arthritis symptoms are particularly severe. Biologics can be incredibly effective in reducing inflammation, improving joint function, and preventing further damage. However, they come with a higher cost and potential side effects, such as an increased risk of infections, so they are typically used under careful medical supervision. While medications are critical for managing arthritis, physical therapy also plays a central role in treatment. Physical therapy focuses on improving joint flexibility, strengthening the muscles around the joints, and enhancing overall function. For someone with arthritis, maintaining movement in the joints and building strength around them can help reduce stiffness and alleviate pain. Physical therapists will guide patients through exercises that are specifically designed to support the joints and improve mobility, while avoiding movements that could cause further damage. Regular physical therapy can also help increase stamina, which can make daily activities easier to manage, and it can slow down the progression of arthritis by improving joint function. A physical therapist might also teach techniques to protect the joints during daily activities, helping to prevent overuse and strain. In some cases, surgical options may be considered, especially when arthritis becomes severe and other treatments are no longer effective. When joint pain and damage become disabling, doctors may recommend joint replacement surgery, which is most commonly done for the hips, knees, or shoulders. In these procedures, the damaged part of the joint is replaced with an artificial joint, typically made of metal, plastic, or ceramic materials. Joint replacement surgery can be life-changing, providing pain relief and improved mobility for many people. While the recovery period can be lengthy and require rehabilitation, the benefits often outweigh the challenges, especially for individuals who have been living with significant joint pain and stiffness. In some cases, instead of full joint replacement, a less invasive procedure like joint repair surgery may be recommended. This could involve removing damaged tissue, realigning bones, or even repairing torn ligaments or cartilage. For example, a person with knee arthritis may benefit from arthroscopic surgery to remove damaged tissue or smooth out rough cartilage surfaces, which can help reduce pain and improve joint function. These surgeries tend to be less invasive than full joint replacement and can be effective for people with moderate arthritis who want to avoid or delay a more extensive surgery. In summary, there are a range of treatment options available for arthritis, each aimed at reducing pain, improving joint function, and preventing further damage. Medications including pain relievers, anti-inflammatory drugs, DMARDs, and biologics are essential for managing symptoms and slowing disease progression. Physical therapy plays a vital role in maintaining mobility and strengthening muscles around the affected joints, while surgical options like joint replacement or repair may be necessary when arthritis becomes severe. The key to managing arthritis effectively is finding the right combination of treatments to meet each individual's needs and improving their ability to lead an active and fulfilling life. In addition to traditional treatments, there are a growing number of alternative and emerging treatments that people with arthritis may consider to help manage symptoms and improve their quality of life. While these options are often used alongside conventional medical treatments, they can provide additional relief and, in some cases, offer new hope for those living with arthritis. One area where people are increasingly seeking relief is through diet and nutrition. Research has shown that certain foods can help reduce inflammation, which is a key driver of arthritis symptoms. Anti-inflammatory foods like fruits, vegetables, whole grains, and lean proteins can support the body's natural ability to fight inflammation. Specifically, omega-3 fatty acids found in fatty fish like salmon, as well as in flax seeds and walnuts, have been shown to reduce the severity of inflammation in the body. These fatty acids help lower the production of pro-inflammatory chemicals and may provide relief for people with conditions like rheumatoid arthritis or osteoarthritis. In addition to eating an anti-inflammatory diet, weight management plays a crucial role in reducing arthritis symptoms, especially for those with osteoarthritis. Carrying excess weight places additional stress on